What does inflammation allow? Allows inflammatory cells, plasma proteins, e.g., complement, and fluid to exit blood vessels and enter the interstitial space. Inflammation is divided into what? Divided into acute and chronic inflammation. What is inflammation characterized by? The presence of edema and neutrophils in tissue. Inflammation arises in response to what? Infection, to eliminate pathogen, or tissue necrosis, to clear necrotic debris. Innate immunity. Immediate response with limited specificity. What are the mediators of acute inflammation? Toll-like receptors, arachidonic acid, AA, metabolites, mast cells, complement, Hageman factor. Toll-like receptors. Present on cells of the innate immune system, e.g., macrophages and dendritic cells. TLR activation results in what? Upregulation of NF-kB, a nuclear transcription factor. What does NF-kB do? Activates immune response genes leading to production of multiple immune mediators. TLRs and chronic inflammation. They are also present on cells of adaptive immunity, e.g., lymphocytes, and play an important role in mediating chronic inflammation. Arachidonic acid, AA, metabolites. 1. AA is released from the phospholipid cell membrane by phospholipase A2 and then acted upon by cyclooxygenase or 5-lipoxygenase. Where are mast cells located? 1. Widely distributed throughout connective tissue. How are mast cells activated? 1. Tissue trauma. 2. Complement proteins C3a and C5a. 3. Cross-linking of cell surface IgA by antigen. Mast cells' immediate response involves the release of preformed histamine granules, which mediate vasodilation of arterioles and increased vascular permeability. Mast cells' delayed response involves production of arachidonic acid metabolites, particularly leukotrienes. Complement. Pro-inflammatory serum proteins that complement inflammation. Where is complement located? Circulate as inactive precursors. Activation of complement occurs via what? Classical pathway, alternative pathway, MBL pathway. Classical pathway. C1 binds Ig or IgM that is bound to antigen. Alternative pathway. Microbial products directly activate complement. Mannose binding lectin pathway. Mannose binding lectin, MBL, pathway. MBL binds to mannose on microorganisms and activates complement. All pathways of complement result in production of C3 convertase, mediates C3, greater than C3a and C3b, producing C5 convertase, mediates C5, greater than C5a and C5b. What forms the MAC? C5b complexes with C6-C9 to form the membrane attack complex, MAC. C3a and C5a. Anaphylotoxins. Trigger mast cell degranulation, resulting in histamine-mediated vasodilation and increased vascular permeability. C5a. Chemotactic for neutrophils. C5b. Opsonin for phagocytosis. MAC. Lyses microbes by creating a hole in the cell membrane. Where is Hageman factor, factor 12 produced? An active pro-inflammatory protein produced in liver. How is Hageman factor, factor 12, activated upon exposure to subendothelial or tissue collagen? Hageman factor, factor 12, activates what? 1. Coagulation and fibrinolytic systems. 2. Complement. 3. Kinase system.